for me, I'm about to close.
Hey y'all, my name is Tiara Tucker. I am a first year Master's of Public Health student at the University of Southern California in Los Angeles, California, and I am specifically concentrating in health services and policy. So this video is going to be my first video, and I will be discussing public health since that is what I'm getting my master's degree in. And I graduated from Howard University in Washington, D.C. last May. Shout out to the class of HU17. Right now, I want to start with what exactly is public health. And basically, public health is a concentration where we study populations of people, whole groups of people, and we focus on prevention. So you can find public health workers in an array of areas, educators, policymakers, epidemiologists. Public health can be found in basically any and everything. Everything. Like, we're everywhere, and it's such a broad field. And we really want to focus on the prevention of the disease. I decided to pursue my master's degree in public health because, one, I'm very passionate about the healthcare system. I studied abroad my junior year while I was at Howard in London at the University of Oxford, and it was a great experience. I recommend anybody to study abroad if you get the opportunity or chance to. You get exposed to many different cultures and just a whole nother system. I met a lot of cool people. And while I was there, I got to study the healthcare system, not only in America, but in the UK, and also in Jamaica. The last 2 weeks of my program, I studied at the University of West Indies, UWI University in Kingston, Jamaica. It's really cool to experience two different healthcare systems. We got to go into the hospitals in the UK as well as in Kingston. It was just cool to compare and contrast and see the good of the healthcare system and some of the flaws of them. And I think it's important to study other countries' healthcare systems because we can actually learn a lot from them. Like other countries, like the UK has universal health care, and a lot of other countries have better health outcomes compared to America. I know in America we spend almost 17% of our gross domestic product on healthcare, yet our outcomes are poorer than most other OECD countries. So it's very important to analyze other countries and see what they're doing and bring some of that back to the policies in America. I also want to be an advocate for vulnerable and minority populations, so that's another reason why I chose to study public health. In my future, I will become a policymaker, not only in America, but other nations regarding health policy, social welfare policy. I'm very, very passionate about the social determinants of health because I feel like that is what's really in control of our health. You have to think about it. What do we interact with more on a day-to-day basis? Like people in America, we invest so much money into the hospital systems, technology, but it's really important to invest that money into our communities and into food, grocery stores with fresh fruits and produce, our education systems, our employment. Those are all the things that really heavily impact us on a day-to-day basis, that impact our health as well, but those are neglected, and that's where the money needs to be spent. So I want to be a policymaker and get some policies set in place that will ultimately create a better environment for those who have a lack of resources. And it's important to me because when I first heard of public health, which I knew nothing about, I'm just like, first of all, it's not that many African Americans in this field. And then on top of that, women are not, although we have an array of knowledge and resources, we're still not put at the forefront of things, and our voice is still not heavily considered. So I would definitely want to be the voice of reason, and I want to bring light to issues that African Americans and other minority populations face most drastically, but yet and still we know the least amount about. Healthcare in general is a field that we are deprived in and somewhat ignorant in, and I want to be able to break it down at a level where we can all understand and just pass around this knowledge, because it's important that we know what's going on, and so that we're able to voice our opinions and get policies in place and systemically change things to better everyone. Because it's not about equality. It's not about equality at all, because although we might be equally resourced to something, we still might be at a deficit or a shortcoming in terms of access to it. So we need to focus on equity and ensuring that everybody has not only equal opportunity, but they have equal access as well. And we just have to make sure that we're focusing on all populations and including everyone. And at the end of the day, that's all that matters. And so be on the lookout for me and more videos. If you guys have any specific questions relating to healthcare, social determinants of health, social welfare, drop the info below, and I'll do some research and get back to you guys, and I want to be able to break it down. And thank you guys for your time. Bye.
Watch out for me, I'm about to glow. You better watch out for me, I'm about to glow. Your boy all glowed up every time we touch down, better